I can go through this again if I need to. So there we go, we're recording. Okay, well, good morning everyone, or good afternoon where you are coming from. My name is Natalie O'Neill. I am a physical therapist that is also a board certified geriatric specialist for physical therapy. In addition to that, I also have quite a bit of experience focusing on public health and minority health. And so today, what I wanted to talk to you guys about is balance and aging, and how we can take action against falls. Okay, so before I get really into specific details about how we can take action against falls, I want to share with you some stats and statistics and information about why falls are so important, and how even someone that's in their 40s and 50s and 60s, even if you haven't even had a thought in your mind about falls and I'm fine, Natalie, I don't have a concern about this, you should be. Because now is the best time for you to prepare for the future. And even if you're somebody that might be in your 70s and 80s and 90s and up, there are still things that you can do to help minimize your risk for falls, okay? So kind of wanted to share some information. The first thing you're seeing is my screen, and this is information from the Centers for Disease Control. It is the most up-to-date data. This is from 2018. And one statistic that should pop out for you is that 1 in 4 older adults reported falling. 1 in 4, okay? So that's 36 million falls just in 1 year, okay? That is shocking and staggering. Now, keep in mind, not everybody that falls, every fall results in an injury, but the first time that somebody has a fall, their wrist goes from being down here all the way to up here. So there's estimated that every 20 seconds, as you guys are watching me, think about this, every 20 seconds that I'm talking to you guys, somebody around the nation falls. And so we have to take action in order to prevent this really broad spectrum of things that are happening that contribute to falls. But there are a couple of tangible things that you as an individual can do to help yourself. Okay, so they do cause falls, and injuries, cause death. So I'm going to scroll down and show you. So for the total of older adults, there's estimated to be about 52 million people, and they categorize that typically as people 65 and over. That's 52 million people, and that's 8 million injuries and 36 million falls. And keep in mind, our population is aging. About 10,000 people in the US turn 65 every single day. So today is July 26th, where we're recording this talk. 10,000 people turn 65. So even if, like I said, you yourself might not be of that age category, or maybe you've already enjoyed your 65th birthday, you should know that this information is relevant. Our population is aging, and guess what? By 2030, we estimate that 73 million people will actually be 65 and over. So that if we don't do something as a nation, or even you as an individual, unfortunately, it's possible that you might fall within this risk category, okay? So the second thing I wanna break down is saying, okay, Natalie, well, that's fine. I'm just, still not really concerned about falls. I don't think this is gonna pertain to me, so I'm just gonna tune out of your lecture. And that's fine, but I wanna share with you our percentage of falls, people who reported a fall. And that, keep in mind, this information is only the people that were brave enough or had enough humility to actually report to their doctor or some other provider that they fell. We don't really know how many people, because they didn't get injured, quote unquote, don't even report that they fell. But if you look from here, males versus females, 26% of adults age 65 and over that were male reported a fall, okay? And 30% of females, okay, so it's a little higher for females. If you're 65 and older, male, doesn't matter male or female, your falls do increase with age. So 26% when you're 65 to 74. Once you get into that 75 to 84-year-old range, it's a 29% risk. And then 85 and over, that's a 35% risk for falls. So I think that's something that should really kind of kick in your brain. And then if you look at, if we break it down by race and ethnicity, the group that has the highest fall risk is actually my heritage and background, which is American Indian. We have a 32% fall ratio, which considering we're like 2% of the population, not going to draw the national numbers, but if you are American Indian and Alaska Native, that should speak to you because that's a 32% of you're in that category. For Caucasians is 28%, Hispanics 28%, African American is 23%, and Asian and Pacific Islanders 16%. So those definitely happen. And then there is some regional differences if you want to take a look. As you can imagine, the purple for this one, even though I love purple, purple's not good. Okay, so the darker the shade of it is, so depending on what part of the United States you're tuning in from, just know that there's certain regions where falls are more frequent. And there's some factors why we might understand why this might occur, but it's still not really widely known exactly why. But let's say my colleague and sister Nia Toomer from New York, they're kind of a light purple, but I just was a professor in California. We both went to USC together. They're a dark purple. So those are more frequent falls. So they don't really know for sure, but I just wanted to kind of point that out as we talk about falls today. Okay, so let me get back to my presentation. All right, so. So now that I talked about it, we're going to learn about falls and health impact. We're going to talk about a couple of risk factors for falls. It is a very extensive, complicated thing. So I just want to talk about some of the main things that you can really just focus on and then take action. You know, as an individual, you want to be empowered to feel like you can help prevent this. I just talked about all these scary statistics and you're thinking to yourself, oh man, Natalie, I got to start doing something to prevent myself so I'm not another statistic. So I think there are some good tips I can leave you with in order to help with that. Okay, so you can feel a little more educated and help yourself. Okay, so vision and fall risk. One of the beauties of aging gracefully is that certain things change. Some things start to change younger than at a younger age, and one of those is vision. Oftentimes people kind of want to put off to the side and don't want to acknowledge that their vision is changing. They start to squint and bring the paper, you know, kind of closer and closer and closer as they start to read it. And in fact, though that might be something that we don't think is too serious, it actually is when we talk about falls. So about 12 million Americans age 40 and over experience vision impairment. And of course, it's how it's categorized. But with an aging population, like I just mentioned in the last pictures I showed you, it's expected to double by 2050. So that's not long from now, it's 30 years from now. If you have poor visual contrast, that means I can't really tell if something is the color from one tone to the next. And acuity, of course, is how clearly you see something. If you have a reduced visual field, for example, someone that might be developing cataracts, that they have a blot in their visual field, or if you have decreased depth perception. So those are all things that you can imagine would lead to a potential for trip and fall, especially when we talk about things like curbs. If you don't have good depth perception and you're walking around and you're trying to sense if there's a curb, you might not, and you might step off stairs or even being on uneven terrain, depending where you live. Some places that can be very dangerous. So people with visual problems are 3 times more likely to limit their activity due to fear of falling. And unfortunately, if you limit your activity, that means you're not getting the proper amount of exercise, you're not getting the proper amount of things to keep you strong and healthy. And for life quality, right? So if you're just limiting yourself, I know I can't see very well and I'm not really sure what to do, so I'm just going to stay home. You're not enjoying your life as you probably could. So the action that you need to take is to have your vision and eyeglasses prescription checked every year, or as recommended by your physician, optometrist, or ophthalmologist. Okay, so it should really be checked frequently, because it even shows if you have eyeglasses and you just kind of carry the same pair around for 3-4 years, oftentimes people go to get their recheck and their vision has changed. So that's one action that you can do to make yourself a little bit more empowered to help with your fall risk. The second one that's really important, and I think our health healthcare system has really improved with this over the last decade is medication review. It's with the age of the computer era and the way that things are really often coordinated amongst the different pharmacies and physicians. The goal would be to have medications reviewed very carefully, because there are certain medicines that older adults take that really increase your fall risk. Many older adults take medications for sleep disorders. So if you can't sleep, those medications, and I'm not saying, I'm not here to give medication advice. That is, as a physical therapist, that's not something I do. But what I'm saying is you have to really be cautious and speak to your pharmacist and your physician about if you have sleep disorders, anxiety medications, high blood pressure medicine, and chronic pain. Okay, so the side effects from these drugs often either change the way a person feels or thinks, so kind of alters your mental sharpness, or can cause drowsiness, a loss of balance, or even some vestibular, which is like that inner ear, can cause some inner ear changes, changes in vision, like I talked about in the last slide, and a slower reaction time. So the point of this is not to say at all, do not take medication, because if a doctor prescribed it, you should, but you need to make sure your doctor, and your primary physician and your pharmacist, they review all your medications frequently. This is especially important if you are hospitalized and discharged with new medications. And I see that frequently as someone that works with a lot of elders that have cardiac problems. They'll have gone to the hospital, the blood pressure maybe might have been really high in the hospital. So the doctor at the hospital discharged with one set of high blood pressure medications. It's really important that your primary doctor and pharmacist talk about that, because you might at home have a handful of other high blood pressure medications, and that can put you at high risk for falling and other things. So just important to make sure everybody knows what you're taking in order for you to be really safe and not fall. The next thing that we're going to talk about is bone health. Bone health is also very important because there's this condition and disease called osteoporosis, and that's a disease in which bones become less dense. It is commonly believed by many in the community that that is just a normal thing that happens as you age, and kind of like visual changes. That's something that we often, think that we'll have to wear reading glasses at some point. Most people do. Osteoporosis is not the case with that. It is not a normal part of aging. It can largely be prevented through diet, exercise, and regular checkups with your physician. I'll give you a few statistics about osteoporosis because it really does vary with racial and ethnic groups. 20% of Caucasian women over age 50 are estimated to have osteoporosis. Okay, about over 50% of all Caucasian women have low bone mass, which means their bones are getting weaker, but they don't yet have the exact. When they scan their bones for density, they show that there's some loss of bone mass, but not quite at a level to be diagnosed as osteoporosis. And they have to take action from their physician in order to change that. Approximately 5% of African American women older than 50 are estimated to have osteoporosis, and about 35% of African American women have low bone mass. However, one thing that really I need to point out is that recent research shows that even African American women who do have risk factors for osteoporosis are not often screened for the disease, because our medical community for so long has said, osteoporosis is something that primarily affects women because of the loss of estrogen as after menopause. Testosterone for men is a protector for their bones and bone density, but our women that are African American, because the risk factor for them that was so low that doctors oftentimes were not even screening for it. And so to me, that is a disservice, because we need to make sure that people are aware of it. And we'll talk about how to keep your bones healthy. Well, one reason we have to always keep in mind too for our African American, Latino, and Native American communities is that lactose intolerance is a huge factor, which means that you can't it makes it very difficult to get enough calcium. So that's something in your youth that we always focus on, is drinking milk. But as we age, or even from the time that they're very young, if you can't obtain that, then your bone density isn't going to be as strong. But don't worry, there's hope for you, because milk is not the only way, and dairy, to get calcium. So how do you keep your bones healthy, Natalie? And once again, there's a couple things that we can do, that you can do without even having to be concerned about dairy and going to, all this lengths for it. Number one, intake of vitamin D and calcium. So calcium is really important, because calcium is what helps our bones, make more bone cells. And vitamin D also aids with that process of making new bone cells. So foods that are higher in vitamin D are fish. Of course, we all love fried fish, but the best way to do that for heart health as well is baked fish or grilled fish. So don't walk away from this lecture saying, oh, I had a physical therapist tell me I have to eat, more fried fish. That's no. Fish, mushrooms, and then of course your milk and eggs are ways to get it. Foods that are higher in calcium, believe it or not, outside of dairy products, are your nuts. Things like almonds are really healthy for you, Brazil nuts, cashews, and then our beans. So especially like the garbanzo or chickpea beans, those are high in vitamin calcium. And then our dark green veggies, so okra, spinach, a lot of the things that we really enjoy with the dark leafy green vegetables. So I'm not a nutritionist or dietitian, but these are facts that we know from, helping with our bone health. So the action is when you do your annual checkup, one thing you really want to do is talk to your primary doctor about your risk for osteoporosis, because I just shared with you that oftentimes if you're from a certain racial ethnic background, because the statistics are in your favor that you have higher bone density, you want to still talk to your doctor about that. Do you have risk factors? Should you get tested? And if vitamin D supplement is okay for you, because oftentimes we're not getting enough of it in our diet if you're not making a conscious effort to think about it. Okay, so those are your actions for bone health. And the other one is weight-bearing exercise. Believe it or not, you just standing and walking. The American College of Sports Medicine recommends that you can even do 2 bouts of 10-minute brisk walking a day will help with your overall health, and that includes keeping your bones healthy. So weight-bearing exercise. Okay, so let's talk about home safety. So that's another factor. That's another thing that you can do to help prevent falls in your home or your environment that you work and live in. So the first thing I love to, as a physical therapist, emphasize is the importance of sturdy, non-slip footwear. And I realize it has to fit correctly. There can be some financial barriers to that. I'm not saying you need to go out and spend a lot of money on really fancy prescriptive shoes. However, if you're a diabetic, you have to wear closed-toe to protect your feet from injury. We know for a fact that diabetics get something called diabetic neuropathy often, if they're, and that's another thing your doctor can check on. But there is a high risk of injury from walking around barefoot or with sandals. So my caveat as a PT is no sandals. I realize that's cultural. I realize there's some cultures that sandals are completely a part of their day-to-day wear. I know there's a convenience factor to that, but I can promise you, in my 13-year career, actually it's almost 14 now, I have had multiple people tell me their fall was when they were either barefoot and slipped on something because they weren't protected, or they were wearing a backless shoe or a sandal and they just misstepped and broke something, and unfortunately ended up in the hospital. So I think sturdy wear, and that's important. So I'm going to share with you this new tip on a home safety checklist. So let me share with you. So how do I know if my home is safe? Natalie, I think I can show you some. This is a checklist that you can go through, our home safety checklist. Okay, So here's a checklist on how to find, and all of this information is readily available. The last slide I'll tell you is for the Centers for Disease Control. So if you feel like you want more information or you actually want to print this out, and if you are a caregiver to an elderly person, especially maybe your parents are in their 70s and 80s and you want to help make sure their home is safe, that is one thing that you can do is print this out and kind of, it's a checklist. So you can go through and check. So the first thing is stairs and steps. Those are often our more common areas that people will get nervous and worried about as they age, is the ability to do these safely, both inside and outside. So you want to look and see, are there papers, shoes, books, or other objects on the stairs? And I know in my household, I'm guilty. We do have a 2-story home. I'm guilty of putting, you know, the kids' extra shoes up on the stairs to kind of get them out of the way. So that's probably not the best for fall safety. So you want to keep objects off the stairs. The second thing you want to look is, are there steps that are broken and uneven? So can we fix loose or uneven steps? And then is there a light or a light switch at the top and bottom of the stairs? Because, you know, stair safety is especially if you have visual changes, knowing where the one step to the next is really important. So it says here, have an electrician put an overhead light. The other thing that you can do, there's a cheap fix, is if you have a plug anywhere, just the night lights. So you want to make sure that you have, if there's a light bulb burned out, and oftentimes these are very high, I do not recommend, and that's going to be my next one, is do not recommend that we have people on ladders unless you are, as a primary part of what you do on a regular basis, like that's your job, you're a handyman, or you have really good balance and stability. And we're going to test that in a couple minutes. Okay. So is the carpet or on the steps loose or torn? Are there handrails? And if they are they sturdy and steady? Okay. And we can go up here and talk about floors. So when you walk through a room, do you have to walk around furniture? So are you having to kind of zigzag through your living room? If that's the case, you might want to think about, for fall prevention, maybe have someone move the furniture so your pathway is clear and you're not having to zigzag around furniture. The other thing is throw rugs. Throw rugs are a very large source of slipping and tripping. So either remove the rugs, or if you really like the rugs, you just have to have them. And I think safety wise, it's good oftentimes in front of like a sink or something, then use double-sided tape or the little non-slip backing so the rugs won't slip out from under you. Picking up objects off the floor, especially if you have a pet, you know, the little pet toys or young children. So, you know, that's oftentimes a source of falling, is keeping things cluttered, picked up. And then wires, cords. So do you have a lot of cords around, making sure that they're either taped down or, you know, moved aside appropriately. Let's talk about the kitchen. So are there things you use often on high shelves? And if that's the case, thinking about organizing or having someone help you organize your kitchen to where you're not having to reach overhead substantially in order to pick something up. Your more frequently things should be put on the bottom shelf, and then things that you rarely use up on the high shelves or down below for safety. So one of my bigger pet peeves is the ladder and or step stool. I have had, unfortunately, multiple fractures from people in their 80s, 70s, and 60s, and I'm not age discriminating, because that is, you know, something that if that is a regular part of what you do and you're strong and healthy, great, but being up on a ladder is likely not the safest situation, and a step stool either. So getting someone to help that, or making sure you have a second person for safety, okay? And then the last two tips are the bedroom and the bathroom. And these are kind of more frequent places that people do fall. They occupy them more frequently. Is there a light? Is the light near the bed hard to reach? So make sure, if it is, put the lamp close to the bed. Is there a path? Is the path from your bed to bathroom dark? And if it is, you might want to think about a small nightlight so you can see where you're walking. And then bathrooms. Is the tub or shower floor slippery? If it is, then you need to put a non-slip rubber mat. And do you need some support when you get in and out of the tub or from the toilet? And we're going to test that shortly too, because I'm going to have you try the chair rise test. And if you do have some trouble, you need to get a grab bar, and those can be easily installed. There's often even resources in your local community if you are a senior and that's something that is important and for your safety. And so yeah, those are the easy home checklists that anyone can go through and do on their own, you know, for a family member or even for yourself, okay? So posture for balance. So here's where I'm going to take a little break from talking so much. We're going to spend the next couple of minutes going over some actual things that you can do. So I'm going to bring my camera back. So if you look at this lady, and I realize the picture is not perfect, but this lady is demonstrating what it's like to have excellent posture. And posture is really important when we talk about maintaining balance and safety. So this person is standing against a wall with her shoulder blades, her butt, and her back of her head against the wall, okay? And her feet are about 2 to 4 inches away from the wall. Her ability to touch the back of her skull against the wall shows that she actually has really good posture. So what I want you to do while you're watching me, and whenever you happen to watch this video, I have a wall here. Let's see if I can get myself in the camera good enough. I'm really tall. Okay, there we go. So what you're gonna do is you're gonna find some clear wall space. Okay, you're gonna stand with your feet about 2 to 4 inches away, shoulder width apart. You're gonna put your butt against the wall. If you have to tuck your belly button in a little bit and squeeze those abdominal muscles, put my shoulders back, and my back of my skull here actually touches, okay, because I work a lot on my posture, always have my whole life, even before I became a PT, because I'm really tall. So that is one check that you can do. If you're not able to, and you have to keep your head forward, I'm exaggerating, that's what we call forward head posture. There are exercises that I'm going to show you at the end of this, these quick screens that will help you, because forward head posture means that you are leaning forward and you have more of a risk for your body and these muscles back here being weaker, and you have more of a risk for falling and falling forward, okay? So forward head posture is something that you don't want to have, okay? The next thing that we're going to do a screen on is your leg strength for balance. So leg strength and having enough power to actually safely lift yourself up out of a chair, whether you're sitting at the dinner table, coming up off the toilet, off the couch, if you ride public transportation and have to get up and down from the bus or the subway, this is an important thing to be able to do. So I want to challenge you. I'm going to get a timer on, and I want you to, if it's safe for you, please, if you know you have recent knee or leg surgery, if you feel like your balance itself is not strong enough to do this, you can just watch me participate. I will set 30 seconds on my timer, and we're gonna, for those of you that are here and with me now, try to play along if you can, because you'll find your score at the end. And I know a lot of people are competitive and they want to see how to do this. Okay, so what I'm going to do is, if I can get my chair, I have a lower chair in my camera. I don't know if I'll be able to get it fully because my table's kind of high, but so you're going to sit in your chair, okay, nice and steady, okay. You're going to put your arms, you're not going to lean against your chair, you're going to sit with nice good posture, okay. Pretend like your physical therapist Natalie is watching you. You're going to put your arms across your chest like this, where your wrists are crossed, okay. And then what we're going to do is, when I say go, you're going to, without pushing up, and once again, if you're not able to do that, that's okay. We'll talk about safe exercises for you to do to get to this point. Your arms are going to be across. You're going to lean forward. You're going to stand up all the way, and then you're going to sit back down all the way. So you want to make sure your chair doesn't have wheels. If your chair has wheels, guess what? You're going to slide. So when I say go, I want you to participate with me, okay? And we'll go together. Okay, arms across your chest here. All right, ready, set, go, and count along. 1, 2. This is gonna be a good leg workout. 3, 4. Some of you might be going way faster than me, and that's okay. Some of you might be going way slower than me, and that's okay. I didn't get my run in this morning since I was presenting, so here we go. All right, almost there. 7 more seconds, 5. Come on, get one more big one in. And stop. Okay, woo, that was a good one. Yes, dismiss. Okay, so you counted along and did it with me. Let me catch my breath a little bit. I have a chart here for where you should be. Now, if you are not quite age 60, you're not going to be on this chart because this is for elders. However, if you feel like you didn't do at least 12, which I did, thankfully, you made the cutoff for average score. Okay, so if you scored like a 15, 16, good job. But you can find yourself here along your age categories. You're thinking to yourself, Natalie, what do I do if I only made 8? Well, I'll talk to you about that in the next couple slides. We need to get you stronger so you have better power to get up and down off the chair and decrease your fall risk. So the next one, the last one I want you to do along with me. This one is called the 4-stage balance test. And you have to be really careful with this one. If you don't have good balance, if you've already fallen sometime in the past, I don't want you to do this with me. I just want you to watch. And if you haven't sought the help of somebody for any balance assistance, we can kind of talk a little bit about that. So what you're going to do is, the pictures are here. We're going to do 10 seconds in each stage, and you're going to follow along. And you're going to see I have a corner here. This is probably the only corner of my household that doesn't have a lot of clutter in it. But we're going to try to do this in a corner for safety. If not, that chair that I just used can be put in front of you for safety. So the first one is we're going to put our feet close together. And we're going to try to stand like this. I have my chair here if I need it. All right, we're going to put our feet together and we're going to do this 10 seconds without holding on. If I need to grab my chair, I can, but I'm going to try to do it without, okay? So we have 10 seconds and go. 9 and 10, good. All right, so if you did that safely, the next thing you're going to do, I can keep my chair handy. I'm going to put one foot slightly in front of the other. So my big toe is touching the instep of my other foot. So once I get there, I can let go, and we're going to hold for another 10 seconds.
Dr. O'Neill, I have a quick question.
Yeah.
Should you have shoes on or no shoes on?
Yes, always shoes. Good question, because we should have shoes all the time when we do these balance tests for safety, if you can, okay? One foot in front of the other, 10 seconds, great. Then this next one is more complicated. So if you had trouble with this one, at this point, I want you to just sit down and you can watch me talk you through the last 2, okay? So if you had trouble at this point, just sit down and be comfortable in your chair, because the last 2 are the tandem stance, okay? That's where you literally have one foot in front of the other, your heel is touching, okay? And you're gonna stand for 10 seconds. Great, okay, so now here's the most difficult one. So once again, if you had trouble with the tandem stance, I want you to go ahead and take a seat and be safe, because the last one is standing on one leg. Whichever leg you feel most comfortable with, you're gonna stand, pick it up, have your chair close to you or your countertop or wherever you're watching me from, and you're gonna stand on one foot for 10 seconds, okay? After you do that, then great. If you can do all 4 of these, you have a decreased likelihood of fall risk, okay? If you had some trouble with it, and you, let's say, were only able to get to your second stage, then you might wanna actually talk to your doctor about your fall risk, and or we definitely have exercises. So if you struggled with the posture one, this one is called Snow Angels on the Wall, and I'll demonstrate it, okay? If you have, so let me do the posture one, because that's what I did first. So my snow angels on the wall, and this lady looks really happy to be doing this exercise. It's not always the most exciting exercise to do, like her photo, but it is important to do for posture. So let me get my video again here. We're gonna stand against the wall, okay? Elbows touching the wall if we can. If you have enough shoulder range of motion to bring your arms all the way back. Now, I played a lot of volleyball and basketball, so my right shoulder is not the best for this, but we're gonna give it a shot. So you're gonna reach all the way up. Those of you that come from countries where we have, and areas where we have snow, when you were a kid, you used to make snow angels. You can go all the way across the wall, do it with both arms. I'm in the corner here, so, and back down. If you don't have enough shoulder range of motion, believe it or not, you can still do this. Just put your arms across, maybe bring your hair, and then just go up to where you feel most comfortable. The important thing is, like I talked about, that forward head posture. So we're working on keeping our chin straight, okay, and pushing the back of my skull or getting as close as I can to the wall and holding the posture. And this is an excellent stretch. A lot of us have spent a lot more time on our computer these days because of the need to be online and virtual. Holding those stretches and doing a set of 10 will really help you feel more stretched out for the day, okay? So that one's a good one to do against the wall. The chair rises. So we did the test, and if you said, like I said, if you were somebody that you only got 7 or 8, well, this is an excellent exercise for you to turn it into an exercise. There is really the best way to actually improve your sit to stand, coming from a sitting position to a standing position, is actually to attempt to do it at least 2 times a day, okay, as you're able to. If pain doesn't limit you and you don't have any other recent surgeries, that should be a very safe exercise to do. You can start with pushing off with your arms, but eventually the goal would be to get where you're across your chest like I was. Yes, question?
During the snow angel exercise, I felt as if because of my posterior hip tissue, that I was arching my back a little bit.
Yes, good question. So if you arch your back, and I'll show you, we're gonna pull, you can stand at least 4 inches away from the wall. If you have gluteus maximus in the way, then what you wanna do is you want to twist your hips. So you're kind of pushing my lower back against the wall, pull your belly button in. Okay, and that will help you. So rather than be here arched away from the wall, I'm exaggerating, of course, you're gonna want to tilt your hips so where your lower back is pushed up against the wall.
Thank you.
All right, good question. Very good question. Okay, so the last 2 that I have for you guys are 2 important ones that we can work on for helping with your balance. So standing heel rises. You can see from the picture here that this person is holding onto the chair lightly for balance. What you do not want to be doing is pushing up against this chair so harshly as I go to raise up on my heels that I'm leaning and I'm kind of pushing myself up off the chair. That's not helpful. We want to have good posture, good alignment. I know you guys can't see my head, but lightly holding on for balance, come up on my toes, slowly come back down nice and controlled. Come up on my toes. You can use a chair. You can also use the countertop for balance if you have to. Either one of those is fine. We want to do whatever is a good challenge for you. So if you come up and go down and you can do 15 of those, great. You can do 15 to 20 of those twice a day. If you try this and you can't even get to 5, well, obviously that is a good starting point for you. So practicing these also 2 to 3 times a day will help you get stronger. It works your calf muscle, and you can see by the arrow here, your calf muscle is one of your most important muscles for walking and maintaining good balance. Okay, so the last one I'm going to leave you with. Yes, good question.
We have a question from the Facebook comments, and someone asked a question about forward head posture. Maybe to explain that when you were going through it.
Sure, absolutely. So let me go back to our picture of our nice lady. Forward head means that this nice lady here is not able to keep her head and her ear in line with her shoulders, her hip, and her ankles. Her head is actually forward or in front of the ideal line that is supposed to be between all of these. So forward head posture, I mean, is typical in people that spend a lot of time in the computer, where we are literally putting our body more forward. It gets to a point where the muscles get so tight, we actually can't bring it back like we normally would. So it is not something that you should be incredibly concerned about. If it's just from a flexibility standpoint, if you don't have any pain, typically stretches and focusing on it and having a good ergonomic setup, which is another discussion at another time, but those kind of things can help you with. So forward head posture is really just a position that the body is out of alignment. Okay. Okay, so our last one I'm going to leave you with is balance practice in a corner. So this young gentleman here probably has this little step stool, but we can use our handy dandy chair. Once again, if you have fall risk issues. If you have fallen and you don't feel that this is a safe exercise for you to do, please hold off on doing this one and don't focus on this one yet, but I will show you and demonstrate. So I like to do these once again in a corner, because in a corner, you have a safe space. I have an area here and an area here that if I were to lose my balance, let me get a little better video. There we go. If I were to lose my balance, I can kind of just fall into my corner. I can just fall into my shutters here, okay, if I have to. So I'm gonna zoom back a little bit more. Let's see if you guys can get me. Perfect. Okay, so right here, I have my chair in front of me if I need it. Okay, I have my corner behind me, and we're gonna practice. So we did the 4-stage balance test, right? Let's say if you got to stage 2, which is the feet, 1 foot, my big toe in front of my other inseam. I stand here, and I'm just gonna practice. I'm gonna let go, hold my hands here, and see how long I can hold it and try to get to that 10-second goal. If I struggle, I can easily catch myself in the corner, okay, or I can grab my chair. Doing a couple of at least 2 to 3 on this with my right leg forward. I know you can't see my feet, but it's just the 1 foot in front, slightly in front of the other. Then we can switch. Left foot in front of the other one. And then once again, I'm gonna put my arms across my chest, try to hold my balance for up to 10 seconds. Okay, or whatever I can do, and then take a break. So you're gonna do that 2 to 3 times on each leg, if it's safe for you to do so. Like I said, in corner, if for me, when I do this, I do a lot of exercise with our geriatrics. Corner is the safest because of the worst case scenario. Look, I can just fall right back into my corner and I'm safe, okay? So that should also ease your fear for doing some of these at home. Okay. Information on today's session. Some of the information can be found on the Centers for Disease Control website. That's called Stopping Elderly Accidents, Deaths, and Injuries, or the study. So it's free, it's readily available to the public. And if you found that you have a lot of questions and concerns with your falls, if you went through all of these and you felt like, gosh, I am just all over the place, it would be a good opportunity for you to talk to your primary doctor or whoever you use for your health, for your medical care, and get some follow-up with it. Any other questions for me?
I have another question.
Yeah.
Dr. O'Neill. What if I do these tests with my mother or my grandmother and I see that there is a problem with her balance? Is there anything that you guys recommend, that you would recommend that I would do with her or as we consult the physician to maybe improve her balance?
Yeah,
once we
I think
her to the risk?
Yeah, I think finding out what it is first. Let's make sure it's not a medication issue. Let's make sure it's not a visual. So talking to the physician, if the physician clears all of those things and just says, you know what, she needs to get stronger. She needs to practice balance exercises. The safest thing for them to do is ask that doctor for a physical therapy consult. And this isn't necessarily a push because I know Dr. Mensah, you and I are both physical therapists, but we are in the terms of balance problems, physical therapists are the best professions to do that. So advocate for your family member. Don't think that, don't let somebody tell you like, oh, that's not going to help because it's hopeless. That's not true at all. We can at least maintain and get some strength. I have 90-year-olds that we have improved and got them better with, it's a two-way street with a 90-year-old being really motivated, while their adult children really helping, and then the physical therapist really being proactive. So be a good advocate for your elder and make sure that they get seen, and don't let anybody tell you otherwise. Keep advocating and keep pushing. So.
Thank you. I feel like the timing is perfect to talk about this. Last week we talked about knowing the deadly combinations of some side effects and medication and how they can play a role. And so now to really show how you can address the balance, I think it was perfect. So I just wanted to thank you for your time. If there's any other questions, now is the time. We're running really close to the end, guys. All right, if there's no other questions, I want to thank you, Dr. O'Neill. Again, Dr. O'Neill comes and joins us from the West Side.
I did forget to say that. I did forget to tell you guys I was broadcasting live from Las Vegas, Nevada, where it's already 90, let's see here, 9:50, and it's already 93 degrees. The high of today is going to be 107. So.
Ooh. Well, thank you so much. I'm going to go ahead and stop the recording.
Okay.
Again, thank you for joining us this summer. We have some more lectures next weekend. Stay tuned to our website, our Facebook and Instagram, and we hope you guys can join us again. We'll try to remember to do some live on Facebook when my internet is working right, so that you guys can join us live. So again, thank you so much, and we hope to see you next week.
Bye-bye. Take care, everybody.